Welcome to Training Module 3. In Training Module 3, you'll set up your DermaFrac system and prepare it for providing treatments. When you receive your system, it will consist of a control console, a DermaFrac handpiece with a tubing set, a microdermabrasion handpiece with a selection of crystal-free microdermabrasion tip caps. If you purchase the optional LED wands, they will also be included, along with patient treatment kits. When you first receive your system, unpack the console, but save the custom foam inserts and box in the unlikely event that your system will need to be returned in the future for repair. Place the console on a stable, non-vibrating surface or on the optional cart if you purchased it, and attach the power cord to the receptacle on the back of the console. Now we need to attach the filter cartridge. You'll align the upper port with the receptacle on the side of the console and then insert the lower bowl until it's fully seated on the holding bracket. Attach one end of the handpiece tubing to the port on the waste canister. Ensure a good seal by pressing it forward. Place the tubing underneath the handpiece holding bracket to keep it out of the way, and then attach that tubing to the handpiece fitting, ensuring a good seal. If you purchase the LED wands, attach the Cool Breeze wands by placing the wand in the holding bracket with the lens side down, then attach the tubing to the airway port, ensuring a good seal, and then align the keyway and insert the connector into the electrical receptacle in the side of the machine. You'll set up the DermaFrac handpiece by first opening a patient treatment kit. The patient treatment kit contains a microchanneling tip cap and smooth applicator tip cap. Remove them and then remove your first treatment cartridge. To set up the DermaFrac handpiece, install a tip cap on the end of the handpiece with the occlusal opening pointing down toward the skin. The tip cap will only seal in one direction. Then remove the plastic shrink sleeve from the cartridge and then remove the red cap. By removing the red cap, it will allow the infusion solution to flow. You must remove the red cap for the cartridge to function. Install the cartridge into the handpiece by aligning the keyway into the groove of the handpiece. Push the cartridge as far forward as possible, and then the handpiece will be ready for operation. You'll adjust the vacuum of the handpiece by first occluding the tip cap with your thumb, power the system on, adjust the vacuum control knob until the needle on the gauge is at the line that is at the upper end of the red DermaFrac range. This is the set point recommended for DermaFrac treatments. Then ensure that the infusion solution starts to flow in the tip cap. You'll set up the microdermabrasion handpiece by first removing the vacuum tubing from the DermaFrac handpiece and installing it in the microdermabrasion handpiece. Then choose a tip cap. It will install only in one direction. Slide the tip cap onto the end of the handpiece. Make sure that it's fully seated to ensure a good vacuum seal. The system should now be fully assembled and ready to proceed. The components you'll need for a DermaFrac infusion are included in the patient treatment kit, or the PTK. Each PTK contains 6 cartridges to be used for 6 consecutive treatments on a particular patient. The PTK also includes one microchanneling tip cap and one smooth applicator tip cap. Most of the time you'll be using the microchanneling tip cap. The smooth applicator tip cap should be used on patients with active acne, and it may also be used as a secondary treatment applicator toward the end of the DermaFrac infusion treatment to provide your patient with a soothing finish to their infusion treatment. Each PTK also includes a patient label located inside of it. Remove the patient label and fill it out appropriately, and then apply it to the outside of the container for easy identification when the PTK is stored. Single treatment kits are also available so that the operator may offer a single treatment to a patient who is considering a series of DermaFrac treatments. Each single treatment kit contains one cartridge of the hydration with antioxidants, one microneedle tip cap, and one smooth applicator infusion tip as well. To prepare for a treatment, you'll need to ensure you have a treatment chair. A massage table can work as well. Cotton towels or 4x4 gauze for cleansing, disposable gloves, a hair restraint for the client, and we do recommend protective eyewear for the client as well. Eye appeal is ideal for this procedure and is provided by Genesis Biosystems. With your initial client consultation, you'll want to educate the client and listen to their concerns. You'll explain the treatment process, the anticipated results, and their responsibilities during the treatment protocol, in particular to ensure they limit their amount of sun exposure during the treatments. You'll want to determine the client's goals and expectations, review indications and any contraindications of the treatment, and then review the informed consent with the client. You'll then formulate a treatment plan that's best for that particular patient, have the client sign the informed consent, and then we always recommend taking digital photographs under controlled lighting to begin the treatment series. You're then ready to schedule the first treatment. The DermaFrac system can be used on skin that's dry or flaking, oily or acne-prone skin, skin with fine lines and shallow wrinkles, skin with blackheads and whiteheads, on patients with uneven skin texture from sun damage, hyperpigmented skin, raised scars and pitted acne scars, and certain types of stretch marks, in particular younger ones that are more pink rather than the older white stretch marks. It's not recommended to perform DermaFrac treatments on clients with cancer, cold sores, herpes simplex, shingles, dermatitis, any open wounds, any autoimmune disorders such as HIV or lupus, if they're on oral blood thinners, if they have rosacea, any type of skin rash, telangiectasias, if their skin is sunburned, if they have vitiligo, or visible or broken blood vessels. It's also not recommended to perform treatments until at least 1 week after having had a waxing procedure, electrolysis, any subdermal filler injection or Botox injection, or a high-frequency or galvanic current treatment. Now let's prepare to do treatments. It's recommended when treating the face to visually split it into treatment regions. We usually start by addressing the forehead, which is also the easiest place to begin the treatment. We then move to the cheeks and mid-face, followed by the chin and lower jaw, and then finally the nose and upper lip region. If you're performing a treatment on the neck, it is usually done last. Each cartridge is designed for a full face and neck for a DermaFrac infusion treatment. You'll always use the microchanneling tip cap unless you're treating active acne. The treatment will consist of at least 2 passes with the microchanneling tip, first in a horizontal direction followed by a vertical direction. Particular problem areas can be performed in a diagonal fashion as well if desired. When performing DermaFrac treatments, you'll gently stretch the skin between your thumb and index finger. You don't want to stretch too tightly though, so that you can allow the skin to occlude and enter into the tip cap orifice. While the skin's occluded, the tip cap is rolled gently across the skin in one direction only. We recommend short, approximately 2-inch length strokes, and then lift at the end of each stroke. You do not want to perform this treatment too fast. Allow approximately 2 seconds per stroke. It's very important to operate the DermaFrac tip cap in a straight line fashion. This is to ensure that you don't cause discomfort to the patient or damage the skin, which can result in streaking. Always ensure that the handpiece tip is pointing downward to allow for consistent serum flow. If the client experiences any form of discomfort, we first recommend decreasing the vacuum levels somewhat, and if the client continues to have discomfort, switch from the microchanneling tip cap to the smooth applicator tip cap. It's the company's experience that a very small percentage of patients find the microchanneling tip cap uncomfortable. Use the whole cartridge of infusion solution per treatment, and if the microchanneling infusion has been completed, you can finish the remaining amount of infusion solution in the cartridge with the smooth applicator tip to provide the client with a soothing experience to finish. You will discard the cartridge after the treatment. We'll typically start our treatment by adjusting the console and the vacuum setting, and then starting on the forehead by gently stretching the skin with our thumb and forefinger, moving the handpiece in short 2-inch strokes. You'll notice that the skin does not become saturated or wet. The infusion solution is penetrating into the pores of the skin with very little waste. It's normal for the patient to experience slight erythema, and that erythema typically resolves within 1 to 3 hours post-treatment. When treating the nose, it's best to start on the bridge of the nose, ensuring that the handpiece is occluded, and then moving from the crest of the nose along the side, wrapping around the edge of the nostril onto the upper lip. DermaFrac is often used on the back of the hands as well. The same technique that's used on the face and neck is used on the hands. After the treatment, the microchanneling tip cap and smooth applicator tip cap should be retained. Each of these tip caps is designed to last for a series of 6 treatments for a particular patient. After each treatment, remove the tip cap from the handpiece, rinse it with warm soapy water, You may need to scrub any tissue particles off the end of the microchanneling tip cap with a small nylon brush. Soak the entire tip cap in chlorhexidine, Sidex, or a similar antiseptic agent, and then rinse it with water, dry it, and store it for subsequent treatments. The tip caps can be stored back in the patient treatment kit, or if you prefer, you can remove the cartridges and the tip caps from the patient treatment kits and store them in a drawer, but we would recommend placing them in a labeled Ziploc bag. To perform microdermabrasion treatments, we will switch the handpiece from the DermaFrac to the microdermabrasion handpiece. We'll choose the appropriate tip cap for the particular patient, and just as we did with DermaFrac, we'll visually split the face into various regions for treatment. You may consider for first-time microdermabrasion patients to apply the tip cap to their forearm for 2 to 3 strokes to give them an idea of the sensation of a microdermabrasion treatment. The microdermabrasion tip cap that is typically used is the standard one, which is gold in color, and it's a 180 grit size. There's also a 240 grit size silver colored tip cap recommended on thin or sensitive skin. And for very problematic skin that's got a lot of damage, a 120 grit blue aggressive tip cap is now available. Microdermabrasion tip caps are also offered in a larger oval size that are ideal for use on the chest and body areas. The oval tip caps are also offered in 3 grit sizes, with the 180 grit size being the standard and most popular. When performing microdermabrasion, visually split the face into treatment regions, starting with a horizontal pass. Be sure to lift the handpiece at the end of each stroke to ensure that you don't abrade the skin. The second pass should be in the vertical direction, and with microdermabrasion we always recommend a third diagonal pass whenever possible. You can feel free to use more passes in problematic areas. Just as with the DermaFrac handpiece, we'll anchor the skin for microdermabrasion between the thumb and index finger using short strokes, lifting at the end of each stroke. Again, it's very important to lift so that we don't abrade the skin upon return of the handpiece. When treating the cheeks and midface, the fleshier areas, it's important to stretch the skin gently using short strokes, but to ensure that the handpiece does occlude, allowing the skin to come up into intimate contact with the abrasive surface. We often ask the client to push their skin outward with their tongue on the chin and lower jaw. This makes it easier for the operator to perform microdermabrasion. We'll also ask the patient to purse their lips to protect the vermilion and to make it easier to peel. When treating the nose, we typically use a sideward motion coming from the bridge down along the lateral aspect of the nose and around the edge of the nostril, on to the upper lip. If you purchase the optional LED wands, LED light therapy may be used as a standalone therapeutic treatment. It's always recommended to be used in combination with DermaFrac or microdermabrasion treatments. You'll first choose the wavelength for the particular skin condition being treated. The blue light is indicated for active acne. The yellow light is ideal for skin rejuvenation, and the red light is typically used to reduce inflammation immediately after a microdermabrasion or DermaFrac treatment, and it's also ideal to even out pigmentation. To operate the LED wand, simply turn the on-off switch on the side of the machine, ensuring that the main power switch on the front of the console is on already. When operating the LED wands, glide the wand just above the surface of the skin in a slow circular motion. The protocol for the face is to use the wand for a 5-minute period across the entire facial region by breaking it up into segments. Add an additional 2 minutes when treating the neck region. At the end of the treatment, gently wipe the lens with an isopropyl alcohol swab. Never run water over the lens or immerse the wand in water. This will void the warranty. There's very little system maintenance for your DermaFrac. We do recommend keeping the handpieces clean by washing them in soapy water and drying them at the end of the day. You will also periodically empty the waste canister and replace the air filter as necessary. To empty the waste canister, first turn the machine off and always wear gloves. You'll remove the handpiece tubing and disengage the cartridge from the side of the machine. Separate the lower bowl and then empty the waste fluid in the sink or in a container for disposal. Be sure not to dispose of the ball valve that's in the waste container. To change the air filter, simply turn the machine off. Again, always wear gloves. Remove the handpiece tubing and disengage the upper chamber of the cartridge. Replace the air filter cartridge with a new one. Whenever the air filter cartridge gets dark gray, it's time to change the air filter. For any further technical support or customer service, you may reach Genesis Biosystems toll-free at 888-577-PEEL, which is 7335. Our local number is 972-315-7888. You may always email the company at support@genesisbiosystems.com. Congratulations, you've reached the end of the DermaFrac training modules. Please take the certification test. The company will issue you a certificate of training with a passing score. You're now ready to perform DermaFrac treatments.